Stop making these skincare mistakes in your 30s. Do you think moisturizer alone is enough to fight wrinkles? No, collagen loss starts now. Are you still using the same routine from your 20s? Your skin has changed and so should your products. And if you're not getting regular professional skin treatments, you are missing out on one of the biggest anti-aging secrets. But don't worry, I've got you. Today, I am breaking down the exact dermatologist-approved routine you need in your 30s, plus the best professional treatments you want to get in the office, lifestyle habits to implement, and supplements that can keep your skin glowing, smooth, and youthful for years to come. Hey everyone, I'm Dr. Mamina, a triple board certified doctor in dermatology and internal medicine, and I love helping people achieve their best skin at every age. I love also taking a holistic approach to skin health, so you'll see me recommend both topical skincare as well as things like lifestyle changes and supplements. If you're new here, be sure to like and subscribe for weekly skincare and health tips. And let me know in the comments, what's your biggest skin concern in your 30s? All right, let's get into it. First, let's talk about what is happening to your skin in your 30s and why your skincare changes a little bit. Okay, so you've hit your 30s and suddenly your skin isn't bouncing back the way you used to. Well, maybe you're noticing more lines, dullness, or even adult acne. Don't worry, you are not alone. Your 30s are a transitional decade for your skin. So here's what's happening behind the scenes. Your collagen and elastin will start to decline, and this leads to the fine lines and less firmness and potentially sagging. You also have a slower skin cell turnover, so this causes more dullness and uneven texture. And then hormonal changes can cause things like acne, worsening hyperpigmentation, and dryness. Your skin barrier may also weaken, so that's gonna make you more prone to sensitivity. So what does this all mean? Well, your skincare routine needs to focus on prevention, repair, and protection. And that includes in-office procedures to boost collagen production and maintain that youthful glow. So first thing, sunscreen. This is a non-negotiable. SPF is your best anti-aging treatment. UV rays, we know, break down collagen, it causes wrinkles and leads to sunspots. There's so much evidence out there to show how UV rays damage your skin. Identical twins, the difference in their sun exposure. You could see one can age faster if they have a lot of sun exposure. So there's that famous picture of the truck driver where he was a truck driver for decades and you could tell that one half of his face, the side that was along the window, was getting so much sun, and definitely you could see a difference in wrinkles. So when it comes to a sunscreen, what do you want to look for? I tell patients, make sure the label says broad spectrum. I say try to go for at least 30, SPF 30. If you're outside a lot, actually more is better. So try to go for SPF 50 or higher. And then there's a whole question of mineral versus chemical sunscreen. And that is a whole nother topic, but either one is fine. It's a matter of which one you think works better for you, looks better for you, the one that you're motivated to wear every day. So when it comes to mineral sunscreens, the active ingredient will say zinc oxide or titanium dioxide. These are a little bit thicker. Oftentimes they are tinted because the whiteness of the mineral sunscreen can make you look like a ghost and leave a white cast on your skin. There's so much talk and people like being concerned that there's issues with chemical sunscreens. There's not enough evidence to say that there are. So we're not gonna go into it, but chemical sunscreens definitely are more elegant. They're more lightweight and they kind of fit better with most skin tones. There's also the whole aspect of tinted versus non-tinted. We do like tinted sunscreens, especially if you're concerned about like hyperpigmentation. In terms of how to use the sunscreen, you wanna use it every single day, even during the winter, even on cloudy days, even if you're indoors all day. And you also wanna make sure that you're not gonna forget your neck, your chest, and your hands, your arms, if you're wearing short sleeves. Those areas also age pretty quickly. I usually tell people it should be the last step of your morning skincare routine before you put makeup on. Okay, skincare recommendation number 2 for somebody in their 30s. You wanna add retinoids for collagen boosting. So your 30s are the perfect time to start or stay consistent with a retinoid. Oftentimes I'll actually tell people to start a retinoid when they're in their 20s, but if you haven't started a retinoid and you're in your 30s, I would definitely start a retinoid now. Retinoids are one of the most well-studied ingredients to show effectiveness in collagen production. When you have better collagen production, you have more smooth, fine lines. Retinoids also increase skin cell turnover, and this can help kind of even out dull or uneven skin tone. It can help with hyperpigmentation. By increasing skin cell turnover, you're also kind of unclogging your pores, so it can help with people with acne and clogged pores. There are so many different retinoids out there. There are over-the-counter retinols, which are great to use, especially if you're a beginner. There's, of course, prescription retinoids, which are a little bit stronger because they work faster. But interestingly, retinols, there are some that could be as effective as prescription tretinoin. They just take a little bit longer to work. Don't get me wrong. Retinoids and retinols are not created equal, but there are some pretty good retinols over the counter. The most common form of prescription retinoid is tretinoin, aka Retin-A. And like I said, these work a little bit faster, but they have a slightly higher risk for irritation. So let's talk about how to start using retinoid if you haven't already. You wanna start, I tell people, low and slow. Start at a lower strength and only start like 2 to 3 days a week. And remember just to use a pea-sized amount over your entire face. People are like, wait, I feel like it's not doing anything. It is doing something. And the thing is, if you use more, you're just gonna get more irritation without any added benefit. I tell people to just like dot it on 5 parts of your face, rub it in, and then you always wanna make sure that you're applying a moisturizer afterwards. This can help prevent irritation. Now, if you are a very sensitive girly or you have very dry skin, you may wanna consider using a moisturizer first to serve as a buffer before applying your retinoid. All right, skincare recommendation number 3 for somebody in their 30s. Please incorporate a vitamin C antioxidant serum into your skincare routine. Why do we love vitamin C? It can make your skin glow, it can fade dark spots, it can improve hyperpigmentation, it can improve collagen production, it protects against pollution and free radicals from the sun, and it works even better alongside sunscreen. So how do you incorporate vitamin C into your routine? So I always say apply it in the morning, usually the first step in your routine, and use it before you put on sunscreen. There's different forms of vitamin C out there. My 2 favorite forms of vitamin C are L-ascorbic acid or THC ascorbate. I find that if you have sensitive skin, THC ascorbate is a better option. I also recommend looking for vitamin C's that are paired with other antioxidants like vitamin E, ferulic acid. There's other antioxidants that are in vitamin C's too that make them work better. I'm a huge fan of the SkinCeuticals CE Ferulic. I'm also a big fan of the Skin Better Alto Advanced. The Revision C+ Correcting Complex has been a longtime favorite for me, especially for those with sensitive skin. So those are kind of pricey. So in terms of like drugstore sunscreens, one of my favorites is the Vichy, the vitamin C serum, as well as the CeraVe vitamin C serum. If you have vitamin C, I always tell patients store it in a cool, dark place. You want to keep it potent. You don't want it to be exposed to sunlight. Okay, skincare tip number 4 I have for people in their 30s. Stay hydrated and nourish your skin barrier. So actually, as we get older, our skin is more likely to lose moisture. So hydration is very important. Ingredients I tell people to look for are hydrating ingredients like glycerin and hyaluronic acid. These really pull in water into the skin. Emollients like skin nourishing ingredients are things like ceramides and squalane. There are so many amazing moisturizers out there. I don't even know where to start. CeraVe makes great ones. Even like the CeraVe PM lotion is a simple night lotion. Love it, lightweight, great for all skin types. The Neutrogena Water Bank is I think a pretty underrated moisturizer. The SkinCeuticals Triple Lipid Restore is bougie but amazing. I love the Laneige line. They have different moisturizers of like different consistencies depending on your skin type. Vanicream also makes great moisturizers, and La Roche-Posay is a longtime favorite. Eucerin also knows what's up when it comes to moisturizers. Moisturizers I usually tell people are like towards the end of your routine. So if you're using vitamin C and you have dry skin, I would apply a moisturizer after that, then sunscreen. So I guess it's not the last step in your routine in the morning, but it's towards the end. And then at night, you want to put your potent actives, whether it's retinoids or something else, and then seal it in with a moisturizer. An interesting tip, it's super important to wear moisturizer at night because we actually lose more hydration in our skin. All right, skincare tip number 5 for someone in their 30s, and that is exfoliation for improved radiance and cell turnover. So one of the biggest reasons your skin starts to look dull in your 30s is that lower cell turnover. When you're younger, your skin naturally sheds dead skin cells every 28 days, but by the time you're in your 30s, that process starts to slow down. So that leads to things like dull, rough texture, clogged pores, and adult acne, more noticeable fine lines, and this is where exfoliation really comes into play. Okay, and then there's the whole notion of like physical versus chemical exfoliation and which one is better. The short answer for me is chemical exfoliation. When it comes to physical exfoliation, think of things that manually exfoliate, whether they're scrubs, beads, certain like powders. And while some of them are great, like I think rice powders can be fine and like not traumatic to the skin, some of these harsher scrubs can potentially cause like micro tears in your skin. So I'm very cautious about recommending physical exfoliants. Chemical exfoliation, I think, is kind of where it's at. There's 3 main types. There's alpha hydroxy acids, beta hydroxy acids, and polyhydroxy acids. Alpha hydroxy acids include things like glycolic acid and lactic acid. That's the most common category. Beta hydroxy acids include things like salicylic acid, and that's best best for people with like oily or acne prone skin. The polyhydroxy acids are a little bit more gentle and actually hydrating, and I love that for people with very sensitive skin. In terms of how often to use exfoliation, it completely varies on your skin type and the type of exfoliating product that you use. Usually with alpha hydroxy acids or AHAs like glycolic acid, we say use it like 2 to 3 times per week. And I typically say use it at night. For BHAs like salicylic acid, it depends on your skin type, but if you're dealing with acne or clogged skin, you could potentially use it every day. And then polyhydroxy acids, this is very gentle, so I'm fine with people using that every day. And like I said, I love that for people who have sensitive skin or things like rosacea. Pro tip, so overexfoliation can actually damage your skin barrier, leading to irritations, more breakouts, increased sensitivity. So when it comes to exfoliation, honestly, less is more. Now, I did a whole separate YouTube video doing a deep dive on all things exfoliation, so if you want to learn more, definitely check it out. Skincare tip number 6 for people in your 30s. Use professional treatments to boost your collagen. We all know collagen production drops in our 30s, so this is honestly the time to invest in professional treatments that keep your skin firm, smooth, and youthful. So some of my favorite procedures for somebody in their 30s are things like microneedling. These use like little tiny needles to stimulate collagen and elastin production. This improves fine lines, scars, and textures. You can pair it with platelet-rich plasma, which is the serum that is drawn from your blood, and that is full of growth factors and other ingredients that can help really stimulate and boost that collagen production. One of my favorite things about microneedling is the minimal downtime. You're pretty red for about 24 hours, and that's about it. Sometimes 48 hours. So it's a great one, especially for somebody who's working or very busy. Microneedling can be done like every 4 to 6 weeks for best results. I would say like between 3 to 5 treatments. I really do love microneedling for people with fine, stubborn lines, like the lines around the mouth, some lines around the eyes, but it's also really great for things like acne scars as well as hyperpigmentation. Another procedure that I'm a huge fan of for somebody in their 30s is chemical peels. Now, there are a wide variety of different chemical peels. There's some mild ones, there's some strong ones, and they can go to like deeper levels of the skin. So you definitely want to like have that conversation with whoever is doing that treatment for you. But chemical peels, essentially what they do is exfoliate your skin in a more intense manner than what you can get over the counter. And what's the point of that? Well, it can help by boosting that skin cell turnover. You're able to help with things like hyperpigmentation, acne scars, and fine lines. Similar things to microneedling, just from a different angle. I love chemical peels for people who just want like overall skin rejuvenation. I would say hyperpigmentation is the skin condition that I recommend chemical peels for the most. You can do chemical peels about every 4 to 6 weeks. I typically tell people you could do between 3 to 5 treatments a year, totally dependent on the person. I did like a couple before my wedding and it was great. It's so funny. I'm a busy dermatologist and I'm also busy making content, and I feel like I don't really have much downtime, so I haven't been doing chemical peels recently because you're kind of flaky for about a week or so. Once again, it depends on the chemical peel. It could be a few days, it could be a couple weeks. All right, another professional treatment I recommend is laser resurfacing. There are 2 in particular that I like for people in their 30s. One is the Clear and Brilliant laser. I feel like this is a good like intro laser for people who just want some resurfacing, refreshing, help with some brown spots, redness. I'm also a fan of Fraxel. That one's a little bit more intense, but if you feel like you got some stuff to work on, that's another great one. Lasers, of course, also help with stimulating collagen, so it can help with lines, wrinkles, but I do like lasers especially for people who have like a lot of sunspots. In terms of how often to do it, it depends on the laser. I would say for like a stronger laser like Fraxel, once a year is fine. For more gentle laser, whether it's like IPL, I would say, a couple times a year, sometimes quarterly for some people. IPL is another one that I like for people who deal with redness and brown spots. All right, last procedure that I am a huge fan of, especially for people in their 30s, is Botox. Botox is a brand, so there's other brands like Dysport, Xeomin, Jeuveau, Daxxify, but just for simplicity purposes, I am just going to refer to it all as Botox, botulinum toxin. I would say with my patients, usually people start looking at Botox in their late 20s, early 30s. That's when we start noticing lines coming out more. And what Botox does is it gets into the muscle and relaxes those muscles so you're not contracting them as deeply and creating those deeper lines. We often use Botox in the forehead lines, in the glabella, which are the 11 lines here, the crow's feet. Sometimes we'll use them in these lines we call the bunny lines, lip lines, and then you could also use Botox to change the shape of your face in like if you have like big chewing muscles, the masseter muscles. You can slim your face with Botox. You could help with dimpled chin by putting some Botox in there. You can help with neck bands by putting Botox in your neck. But I think, starting off in your 30s, just a little sprinkle in the forehead and around the eyes can make a pretty big difference. Also, by the way, like, all of this is completely optional. I don't want people to think they have to go and get all these things. I just want you to be informed of all the things that are available in case this is something you want to do and you want to work on wrinkles. I just want people to feel empowered with tools and knowledge of what is available out there. Botox, one of the biggest downsides I would say is that it's not permanent. It fades after a few months. And depending on the brand, some can fade sooner than others. I would say Botox typically is 3 to 4 months in my experience. Dysport's a little bit longer, 4 to 5 months. And for some people, they can go like 6, 7, 8 months before getting another round of neuromodulator. Also, if you're not sure whether or not you're a candidate to start Botox, if you just look at your skin and you see lines at rest, like if you look at your forehead and you see wrinkles and you're not raising your brows, that would be a reason to consider Botox. Like I said, all of this is optional. It's a matter of how much your skin and the wrinkles bother you. Do what makes you feel good. All right, skincare tip number 7. We're getting more now into the lifestyle and habits that can contribute to aging or preventing aging. So what are some things that you can do in your everyday life in your 30s to just help promote glowing skin? 1, you want to prioritize sleep, okay? Sleep is when you are repairing your skin. It's restorative. It makes your skin cells work better. You need your skin cells to function well in order to have healthy glowing skin, and sleep is a huge part of that. All right, let's talk about skin-friendly foods. This is a whole nother topic. Basically, what I tell people, you want to eat foods that are rich in antioxidants, like fruits and vegetables, like the colorful foods, as well as foods rich in fiber. And you also want to include things that have healthy fats, things that are high in like omega-3s. You want to limit things like alcohol and sugar. Both of these we know for sure contribute to aging. They increase inflammation, they can increase acne breakouts. Easier said than done, but alcohol and sugar are 2 things you really want to consider minimizing. Also, I would make sure that you're pampering yourself a little bit. Getting a facial or doing facial massages, I think that it can definitely have benefits to the skin. Improving circulation through like physical manipulation, whether it's gua sha or just using your hands or through a facial, I think can really bring more nutrients to the skin and give that added glow. Finally, let's talk about supplements and what you can do to support your collagen. Skincare is not only about what you put on your face. I also am a huge proponent of looking at what else you're putting in your body. So we do have decent evidence of different supplements that can help support collagen production, or supplements that can help combat oxidative stress and do things to keep your skin looking youthful and glowing. Okay, so first there's collagen supplements. I feel like I could do a whole separate video on this. It's a very kind of talked about subject, and there's a little bit of controversy because some derms think that we don't have enough studies. I'm kind of in the pro-collagen camp. I think we have enough compelling evidence to show that hydrolyzed collagen peptides can really improve collagen production in the skin and contribute to like glowy, healthy skin. Collagen supplements can also help with like hair and nails. So what do you want to look for? You want to look for something that says hydrolyzed collagen peptides because those absorb better. You want to look for more like type 1 and type 3 collagen. And if it has like other added components like vitamin C, hyaluronic acid, those can help maximize the benefits. You just want to make sure that you're getting it from the right source. There's a type of collagen called Verisol that I think has been very well tested and is pretty effective. And there's different brands that use Verisol in their collagen supplement. All right, so another supplement that is, I think, kind of related to collagen supplements are amino acids. Some of these amino acids include things like glycine, proline, and lysine. If you're like plant-based and you're not sure about taking collagen supplements, you may definitely want to consider looking into amino acid supplements. Another type of supplement that you might want to look into are antioxidants. We know that oxidative stress is a huge cause of aging, and antioxidants can help combat the damage, the free radicals that are formed by the oxidative stress. These free radicals like wreak havoc on our skin, our collagen. So we want to stop the free radicals from doing damage. So what are some good antioxidants? Vitamin C. Vitamin C we know works well. It also improves collagen production, and it does work well with vitamin E. Astaxanthin. So this is a powerhouse antioxidant that can reduce wrinkles as well as UV damage. I'm also a fan of like resveratrol, other polyphenols. These are found in like really richly colored foods like berries. Coenzyme Q10 is another one that's been getting some spotlight. This can improve cellular energy and skin firmness. Pro tip, polyphenols are great for reducing inflammation in the the skin. So they are a game changer for people who deal with redness or rosacea. And then there's omega-3s. I talked about incorporating omega-3s in your diet. I also think taking a supplement is helpful. Having healthy fats is so important for improving the quality of our skin cells. They really nourish our skin cell walls, which then in turn gives us a healthier skin barrier. Omega-3s also have anti-inflammatory effects, so I like them as well for people who deal with inflammatory issues, whether it's eczema or rosacea or psoriasis. I do think that fish oil is one of the best sources for omega-3s, like EPA and DHA, but you can still get omega-3s from like algae-based products if you're plant-based. So your 30s are all about prevention, hydration, and collagen support. If you have the right skincare routine, the right professional treatments, the right lifestyle habits, you're gonna have glowing skin for years to come. What is your go-to skincare step in your 30s? Drop a comment below, share what you love to do. If you like this video, please subscribe, turn on your notifications for weekly skincare and anti-aging tips. And if you want my top dermatologist recommended skincare products, check out the description box for links.